Thank you so much for joining me today. I really appreciate it. I just want to start by asking you, I guess, are you satisfied with how the vaccination campaign is going right now?
And am I limiting my answer to Quebec or to Canada or to the world? Which is the framework here?
Quebec would be ideal. Yeah, please.
So overall, Quebec's vaccination campaign is going well. In fact, if you look at the current numbers, I mean, the last few days, we're giving 60,000 something doses a day. And of course, it was just late last week that we hit that record of just over 100,000 doses given on a single day, which I think was quite pleasantly surprising. And if you look at the target where we're trying to reach, it was something like 5.5 million first doses given to Quebecers by June 24th. And if you look at the pace or the cadence, we're actually in advance of that. That if we were to continue at current trends, we would actually get there before June 24th. So from that point of view, things are going very well. Now, please keep in mind that is the first dose, and that is not the full dosing schedule because Moderna, Pfizer, AstraZeneca are all two-dose vaccines. And there's increasing evidence that that second dose is important on several different levels, not only for extending the duration of protection, but actually generally giving a broader level of protection. And especially when it comes to transmission and acquisition of some of these variants, it appears that vaccination does work well, but obviously the highest value in the population is when the population is vaccinated fully and has mounted a full immune response, which of course takes roughly 2 or 3 weeks after that second dose. Okay, but that needs to be done before the arrival of a variant, not in the middle of or after if you want to get the maximum effect. So we are well on our way with the first dose, and now to my mind, it's really a question of getting that second dose and sort of deciding who gets that second dose first. In a way, it's almost like another round of prioritization, although whether we will stick to the same priority scheme, I mean, I think it was just yesterday, Quebec has announced that all of the second doses have been given to all the CHSLDs. So that group's already done. But where do we go from here? Do we prioritize healthcare workers? Do we prioritize younger people and frontline workers where the burden of the disease seems to be the most, generally speaking, during this current wave that we're seeing in other parts of Canada?
And do you think that in that same line of thought, do you think it would be a good idea to modify the priority list that we had when we gave out the first dose, or do you think that keeping the priority list that we had is a good idea?
It's an interesting question. I think there can be and there should be a discussion about exactly this. I wouldn't say that we necessarily need to follow exactly the same priority list. I think you could make an argument. Now, again, obviously I'm intrinsically biased because I am a healthcare worker, but I think you could make an argument, and others have made this argument before, that in the setting of a pandemic where one of the biggest consequences on a population level is sudden burden on the healthcare system, you can make a good argument to protect that healthcare infrastructure. And by infrastructure, I really mean the personnel that keep the whole thing running. So I think you could make a decent argument to prioritize people involved in administration and delivery of healthcare to Canadians as people who should get that dose earlier. Now, but by looking at the supply that we are getting and expecting to get over the next several weeks, it looks like we will be able to both speed up the current schedules of who's getting the first dose, as well as speed up the schedules as to who's getting the second dose. So we may not be in as tight a bind as we were a few months ago, and the arguments over prioritization may not be quite as stringent because of the more abundant supply of the Moderna and the Pfizer. We still don't know for sure, given that we have a very, very limited supply of AstraZeneca. It's looking very likely that people who got AstraZeneca as their first dose will probably have no choice but to get some other vaccine as their second dose. There is animal model evidence to strongly support that one of those two mRNA vaccines actually would probably give a very good boost to the immune response, and again, actually probably even broaden the repertoire of antibodies and other immune responses that are generated. But we don't have solid human data at the present moment to confirm this. There are studies underway. The famous one is the COMCOV study in the United Kingdom, but that's probably going to be about another month and a half before they report. So until then, we're flying on inference and sort of supposition and educated guesses. And there's very good reason to think that at the very, very worst case, switching classes of vaccine will give you an additive response, but not that it's going to give a negative, like a harmful response or anything like that. So I'm not worried about it. It's just a question of, is it going to be a kind of a waste of that valuable resource? Or, like I said, there is at least animal model evidence to support that this actually might even give a superior response. And I would love to see solid data come out to support that, because that actually could change going forwards what we do.
And so the vaccination campaign now is opening up to younger people. So I think 30 to 34-year-olds can now get their vaccine, and 50% of them have actually already booked their appointments. Now, how do you react to that? Is that encouraging? How do you feel about it?
I mean, I would love to see that number go even higher than that, but that certainly is encouraging. I would remind everyone of one important thing, which is that all of the vaccines that are currently being given in significant numbers here in Canada are all 2-dose vaccines. And like I mentioned earlier, the first dose alone is not fully sufficient and not fully protective. So just because you get the first dose and everything's going well, follow up, get that second dose. That will serve you very, very well. And this really is a good illustration of that old saying, how an ounce of prevention is worth a pound of cure. Get vaccinated and get full immune response while there isn't a lot of disease running around, but that will serve you super, super well and serve us as a population very, very well if there were to be subsequent waves in the weeks or months to come. So this is really hugely important for our future in terms of being able to be resistant against subsequent waves. I can't emphasize that strongly.
And we've heard the Quebec government, and even Christian Dubé mentioned it yesterday on his Facebook page. He wrote basically an open letter to youths to get vaccinated. Can you? Yeah, you did. So can you tell me why is it so important for youths to get vaccinated?
I think there's at least a few separate reasons. So first of all, just because younger people, generally speaking, tend to not get as sick as older people, doesn't mean that they are unimportant in the big scheme of things. Far from it. I think there's ample evidence that younger people can get exposed, can be infectious, and can pass it on to others. Okay, and so by vaccinating everyone that we can in a population, you really cut down on those roots of sustained community transmission that had plagued us here in Quebec for all of those months in 2020. So getting vaccinated now, even if there isn't a lot of disease right now, but this is exactly the right time to do it, because then you'll be fully immune. Because we've all seen this happen time and time again, where a country says, oh, look, we got this all figured out, we're doing really well. And then a week later, things are going really fast in the opposite direction. And you need a few days to restart a vaccination campaign. You need that 2 to 3 weeks after the first dose. You need to get that second dose in as timely a fashion as you can. And all of that takes time. So ideally, you get that done when there isn't a lot of disease running around. That's not a waste. That's super useful and protective. You don't close the barn door after the horse has already run in. You close it beforehand.
And I think Quebecers, I think under 17, they represent like something like 19% in the population, in the Quebec population. So what would it mean for Quebec as a whole to have that group and 18 and over still in the younger population vaccinated?
I think that would be very useful for use and for the Quebec population. Not only would that really greatly reduce chances of community transmission in the summer months, I think that will make our schools much more stable and much more resistant to being going through these cycles of individual classes, shut down and sent home, or whole schools shut down and sent home. You look at the numbers for the proportion of all Quebec schools that have been affected by this, it's massive. And I think this is an important step towards getting things back towards normal. I'll also point out another kind of conceptual reason to get vaccinated is that there's still, despite all of the months that we've been in this pandemic, all the research that has been done and is still being done, there's a lot of things we don't know, particularly around potential long-term consequences of being infected. And if you can do something to avoid being infected, or at least infected severely, like get vaccinated, then that eliminates that potential risk, right? By some studies, 10% of people who get a COVID-19 infection will have symptoms for several weeks afterwards. Why go through that, especially in the middle of what is promising to be a glorious summer here in this beautiful province, if you can avoid that by getting vaccinated now?
Thank you so much for joining me. I think that's all the questions I had for you. I really appreciate it. Thank you.
My pleasure.